Welcome to Atlantis. We do more than just surgical procedures here. We have an aesthetic side and we have a primary care side. You're looking at one of the few docs that knows a little bit about, just a little bit, about nutrition and about health and about and how nutrition affects healing. So I come from the perspective of not just surgical perspective for doing a procedure, but from the health perspective. The laser-assisted liposuction, that's where you're attached to basically a laser or an ultrasound, and the incisions are very small. The incisions are about about the size of the tip of a pen. So they're about that size. And the reason why they're that size is because this is the laser. So there's the laser. This is attached to the power. And this is the laser fiber. And the laser fiber goes underneath, in through that small incision. This is why the incision is so small. Goes into that incision underneath the skin, and I melt the fat like butter. So I go in, I melt the fat, and so what happens when I liquefy the fat? Makes it a little nicer coming out. And let's say I go too deep. So if I go too deep and I hit that muscle, what's this going to do? Right, so I'm not really going to bruise you. Really, I'm not going to bruise you. It'll hurt because of the laser, ouch. And that's how I know to back off if I go a little deep. So you're not under general anesthesia, you're under what's called twilight. I make you drunk, in other words. I just make you drunk. I make you drunk with two different ways, and you'll like it too. Some people tell me some secrets while I'm in there. I keep very, very good secrets, so trust me on that. So we go in, I get you medicated with oral medications. Like, I'm just going to give you two examples, Valium and maybe an oxycodone or Percocet. And what I do is I take fluid, a numbing fluid, anesthetic, and I go in and I give you what's called tumescent fluid, and I go right into that small incision, and I put in that fluid to help numb up that area. So you're kind of sleepy, you're relaxed because of the medication. I go in and I numb you up locally, and then the next day you can drive yourself. You can do your whatever activity that you normally do on your own, you can do on your own. You can drive, you can move around, but depending on the areas, you will be sore. I have done some work on you. And then you can go to work in about 2, 3, 4 days, not 2 weeks. So you don't have all that downtime. This is for sculpting. This takes an area of the body and changes it. So let's say you're shaped like this, right? And I do the liposuction and I shape you like this. So I bring in that waist, or I give you more butt, or whatever it is you're looking for. So let's say shape you like this, and I'll hear, these are the common things I'll hear. Dr. Gonzalez, what if I gain weight? Will it come back? The answer is yes. You can still gain weight, of course. I'm not taking your ability to lose or gain weight, but you remain this shape. You'll just be bigger. But that shape stays the same. That shape stays the same. This is body sculpting. This is what body sculpting is all about. I'm reshaping you. There are a lot of liposuction ads out there that aren't truly liposuction. If you hear anything out there that says liposuction, and you can do this in 6 treatments or 4 treatments, this is a 1 treatment thing. Maybe 2 if you need a touch-up, depending on areas, depending on size, all those things. Sometimes it takes 2, but 1 treatment to get that shape. I guarantee I take the inches off and I show you the day after what you look like. On the other ones, I can't guarantee that. I can just guarantee you'll have a reduction. I just can't tell you how much.